Hello and welcome to this National Pathology Week video. My name is Dr. Susie Lishman and I'm President of the Association of Clinical Pathologists. This series of videos on pathology myths and misconceptions was recorded as part of National Pathology Week 2024, an annual celebration of the vital role that pathology plays in everyone's healthcare. It was developed by the Pathology Alliance, an umbrella organisation of all of the UK's pathology societies and organisations. In this video, Professor Joanne Edwards will explore the statement, "Cancers are all caused by genes, so you can't change your risk."
Hi everyone, it's a pleasure to be able to talk to you tonight to dispel this myth. I'm Joanne Edwards and I have a cancer research group within the University of Glasgow, and the research we do involves using pathology in patient tissue to identify new ways of treating cancer, and also new ways of predicting how cancers will respond to certain therapies. First slide, please. There is a common myth that cancers are all inherited. However, although some cancers are linked to inherited genetic mutations, meaning that a mutation can be passed on from a parent to child, these account for a very small proportion of cancers, only about 5 to 10%. And people who inherit these mutations are only more susceptible to developing cancer, but don't necessarily mean they will develop these cancers. So by inheriting the mutation, it doesn't guarantee that a cancer will occur, as any other factors come into play as well. So not all cancers are inherited, and in fact, most cancers are caused by a combination of genetic events that occur over a person's lifetime due to different factors such as environmental factors, lifestyle choices, or random errors during cell division. Next slide, please. So I've talked a bit about mutations already, but what are the mutations? Are the different types of mutations? So the majority of cancers, around 90 to 95%, are sporadic. And this means that they're not inherited, but they're due to mutations acquiring during the person's lifetime. So sporadic mutations are those that occur randomly or by chance in a particular cell and are not inherited from your parents. These mutations arise during a person's lifetime and are not present in every cell of the body. They occur during the natural process of the body, and they're errors that can be caused during cell replication. Age is therefore an important part of this. As cells divide, there's a chance for these errors or mutations to accumulate over time, increasing the risk of cancer. So sporadic cancers generally arise without a family history of the disease and are caused by mutations that occur only in the affected tissue or cells that the cancer arises on, and these are generally not passed on to children. Acquired mutations, like sporadic mutations, can occur after birth and are not present in the germline, the egg, or the sperm, so they cannot be passed on to their children. So sporadic mutations are a type of acquired mutations, but most sporadic mutations are caused by acquired mutations. And different environmental factors can cause these, such as exposure to tobacco smoke, radiation, UV light, or things such as viruses, lifestyle factors, or aging. Next slide, please. However, it's not all about mutations. There are other factors that can cause a cell to change and acquire cancer. There's changes such as epigenetic changes, and these can definitely contribute to cancer development. Bowel cancer is often associated with genetic mutations, epigenetic changes, which modify how the genes are expressed without altering the underlying DNA sequence, and can also play a critical role in the cancer progression. Types of epigenetic changes are modifications that can affect a gene's activity without changing the DNA sequence itself. These changes can cause a gene to be turned on or turned off when they shouldn't be. And key types of epigenetic changes include things like DNA methylation, which can typically silence a gene. Histone modifications can make changes to proteins called histones around which the DNA is wound, affecting how tightly or loosely DNA is packaged. And this can either promote or suppress gene expression. And also non-coding RNAs, small RNA molecules that can regulate gene expression post-transcriptionally. And these epigenetic changes can contribute to cancer. Cancer arises from normal cellular processes such as cell division and DNA repair and are disrupted, leading to uncontrolled growth. Epigenetic changes can control the cancer in the following ways. They can silence suppressor genes, or they can activate oncogenes, and they can disrupt DNA repair mechanisms. Epigenetic changes can silence genes involved in DNA repair, allowing mutations to accumulate unchecked. This increases the likelihood of genetic mutations that can lead to cancer. They can also influence the environment in which the tumour exists. So they can not only affect the cancer cells, but they can also affect the surrounding tissue and the blood vessels and the immune cells, promoting things such as angiogenesis, which allows new blood vessel growth. Certain lifestyles and environmental factors such as smoking, diet, stress and exposure to toxins can lead to harmful epigenetic modifications, which can increase cancer risk without directly causing DNA mutations themselves. For example, a poor diet can lead to changes in DNA methylation that can increase cancer risk, while some foods, such as green tea, are thought to have protective epigenetic effects. So epigenetic changes can play a significant role in cancer development by silencing tumour suppressor genes, activating oncogenes, and disrupting DNA repair, affecting the tumour microenvironment. Next slide, please. So this is all around. We have no ability to change a risk of cancer because it is all in our genes. So what I would really like you to take away from this is that although cancer can arise from mutations in our genes or even epigenetic changes to the genes, we have some control over the risk we have of cancer. Cancer risk can be influenced by a variety of factors, including lifestyle choices, environmental exposures, biological processes, and genetic predisposition. Lifestyle factors, including not only tobacco use, but secondhand smoke, alcohol consumption, diet, eating processed meats, obesity, and physical inactivity can all be associated with increased cancer risk. Environmental and occupational exposures to certain chemicals or radiation and UV are associated with increased cancer risk. Infections can be associated with increased cancer risk. So there's all sorts of things that influences your risk of cancer, and some which you can actually modify, such as increasing exercise, not smoking, lowering your alcohol intake, example. So although a small percentage of cancers are due to inherited genetic mutations, this is only a small percentage, and there are many factors that we can do and have control of that will lower our risk. So cancer risk is influenced by a combination of factors, and we do have some control over this.
I hope you enjoyed learning the facts behind that myth. You can see more of these videos on the Royal College of Pathologists YouTube channel @I Love Pathology.